start a new session in the Mega Online Anesthesiology course. It will be about a very important topic, which is the communication skills. So first, I'm going to present Dr. Ahmed Abdelaatti. He's currently Senior Registrar in Anaesthesia, Critical Care Medicine and Pain in Mater University Hospital in Dublin. He is a Fellow of the College of Anaesthesiologists of Ireland, and he holds MD, European Diploma of Anesthesia and Intensive Care, and currently doing Master in Healthcare Simulation and Patient Safety in the National University of Ireland in Galway. He will give us an interesting talk about introduction, models, types, and barriers to communication.
So, hello everyone. Thanks, John, for this nice introduction. Today, I'm going to speak about the communication skills, which is really a good skill to gain, and you have to master it to be able to manage in a challenging healthcare in any of the Western countries all over the world. So we start by definition. Communication is a major part of good teamwork, NUIG began in 1978, and it's a fundamental to workplace and safety. Communication is the exchange of information, feedback, or response, ideas, and feelings. It provides knowledge, institutes relationships, establishes predictable behavior patterns, and maintains attention to the task, and is a management tool. So it's part of the management tools, it's part of the leadership tools, so there's no way that you can't master this skill to continue. And the components of communication are what, how, why, and who. So always ask yourself before transferring a message or sending a message to anyone, especially for handovers, communication in the ICU, in the intensive care, for example. So what are the information to be communicated? How? The means to communicate the information, the way of technology. Is it face-to-face? Is it over the phone? Is it by email? Those kind of things, you have to understand how you are going to communicate the information. And then why? The reason for communication, why you are doing this communication, and who are the persons to whom the information will be communicated. The elements of communication, you have to send the information in a clear, concise, and precise way. You have to include context and the intent during the information exchange. Receive the information, especially by listening. So listening forms 80% of your management of this part of the communication. So if you listen well, you will understand, you will be able to encode or process the information, and then you will reply. Identify and address barriers to communication. And always remember that communication behavior is a skill that can be structured by organizational policies, such as standard operating procedures, and can be shaped by training. So everything can be gained by training. Even if you are weak at the beginning, you can develop your skill by training and training and training. So always practice, practice, practice. It also refers to the qualities or styles of interaction while messages are communicated. And then actions are coordinated by issuing instructions, stating your intentions, sending and receiving the information. So it's very vital to understand, listen first, understand, process the information, and then reply. Here is an example, just to make the topic a little bit less boring. So that's outside the medicine. The Piper Alpha disaster, 6th of July, 1988, very well known. That's an oil deck in the North Sea in front of Aberdeen, 200 miles in the sea. Of the many factors contributed to the explosion was failure of transmission of relevant information at shift handover. Knowledge that a pressure safety valve had been removed and replaced by blind flange was not communicated between shifts. So as a result of this, the actions taken by the incoming night shift presumed to have initiated the disaster. That was the result. Famous story on The Guardian. and only 64 persons of more than 200 persons survived. In medicine, another example, a study of 47 cases of perinatal death or permanent disability indicated that communication issues topped the list of identified root causes and represented 72%. Examining adverse events in the intensive care unit found that communication featured as a prime cause in many reported incidents. The exchange of information is a core activity for decision-making, situation awareness, team coordination, and finally, leadership. The models of communication. We have one-way communication, where you have the information that you want to process, and then you encode this information. So you think about what you are saying, or you want to say first, and then transmit this information to the receiver, where the receiver will decode or analyze or process this information, which will have a meaning for him. It has advantage and disadvantage. One of these advantages is rapid, locked sound, and made the sender feels in control. The disadvantage of this is generally requires planning. The responsibility lies with the sender. There's no feedback, and the receiver may not pay adequate attention. Examples of this are emails, memos, and those kinds of things. The two-way communication is another model. So where you have the information, you process the information, you transmit the information to the receiver. He decodes or analyzes the information, which have a meaning for him, and then he think about it. He may process information in his head, and that's called encoding again. So he plays it in return. So he sends the information to the receiver, which was the first playing as a sender. Then he decodes or analyzes the information, then this information has a meaning. The advantage of this potentially is more accurate, reliable, and effective. It permits the checking and correction of details, requires less planning. Receivers have more confidence in themselves and make more correct judgments of accuracy. Sender and receiver have responsibilities. The sender and receiver work together to achieve mutual understanding, and we'll come to examples of this. The disadvantage generally takes longer. Receiver also has to communicate in return, so it's double way. Another example here, the fatal failure in two-way communication by Garuda airline flight, famous flight disaster in 1996. Where the flight flew into a mountain 15 minutes before landing and 20 miles from the airport. The air traffic control error resulted into the plane rerouted into mountain terrain in Indonesia. This flight was between two cities from Jakarta to Medan, Indonesia. All the 234 passengers and crew were killed. Here is a conversation from the Aviation Safety Network from the black box afterwards. It's double-way communication, so a sender, receiver, and back between each other, double-way. Air traffic control, GIA 152, turn right, heading 046, report established localizer. GIA 152, turn right, heading 040, so that's number one mistake, the degree he asked for. GIA 152 check established. Air traffic control, turning right, sir. GIA 152 in reply, Roger 152, which means the information has been understood and being processed. Then here is the start of another confusion. Air traffic control 152, confirm you are making turning left now. He was asking to turn right, now he asked to turn left. GIA 152, we are turning right now. Just an objective statement to show that the previous instruction was to turn right. Air traffic control 152, okay, you continue turning left now. So it means the information has been changed. Now the confusion started back again from the GIA 152, a pause, thinking, confirm turning left. then we are starting turning right now. Air traffic control, okay. Opposed, okay. And then the flight went into the mountain. Differences between one-way and two-way models. One-way communication is faster and hence more efficient. But the two-way communication is more accurate, but it depends on the sender and receiver to work together to ensure the information is understood. In reality, we mix between both, depending on the situation. The key difference between both is the feedback. Feedback enables the sender and receiver to ensure that the meaning within the information has been understood. It closes the communication loop and is the simplest way of preventing any misunderstanding in the receiver's interpretation of the original meaning of the message. For example, in the ICU handover, your colleague says something, there's some ambiguity about it, then you stop, you ask a question, or you confirm what he said, then he replies back. Feedback can range from a simple nod by the head during conversation to a written comment on a paper communication. And here are the types of feedback. Could be informational, where the receiver provides a non-evaluative response, provides an objective statement in response to an initial statement, as it was a conversation between the air traffic control and GIE 153. Could be corrective. The receiver challenges or corrects the sender's message, such as questions or queries the initial statement to gain clarification. Reinforcing, such as the receiver acknowledges clear receipt of the message, check understanding of the message. Here is how you do effective communication. You have to have a clear message, a correct message, a complete message, a precise message, reliable, consideration of the recipient as well. You have to know who is the recipient of the knowledge. Like, for example, you're working with different colleagues and you're at senior level, talking to a junior colleague, you have to give him clear instructions and straightforward. Sender's courtesy, you have to add to the information you're giving. Types of communication moving from air flight businesses and or industry and oil industry to the healthcare now. So we have types of communication in healthcare. If you see this picture on the left side, the picture is just it's a reflection of what the healthcare composition is. It's multicultural. And that makes it more difficult than the industrial world. As well, the healthcare management is complex and dynamic at the same time. So the judgment depends on the situation you are in. Communication is part of your management and leadership tools. So you have to master that. We'll go through the communication types here. So healthcare professionals should work to master essential types of communication that could be verbal, nonverbal, written, and professional business communications or remote communications. So why communication is important in healthcare? Communication is vital in all industries, but particularly in healthcare, as lives quite literally dependent on it. Doctors, nurses, administrators, and other healthcare professionals must communicate effectively, not only with each other, but also with the patients. To understand their medical conditions, take the appropriate medications, and have conversations with their doctors, patients should be health literate as well. So it's double way. The Institute of Medicine defines health literacy as the degree to which the individual have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. An important correlation exists between health literacy and a clear communication between the patient, the doctors, or the patients and the nurses, or the doctors and the nurses. Poor communication and misunderstanding can negatively impact a facility's ability to deliver a quality of care. And here are types of verbal communication required. So it's between the medical professionals and patients, between different specialties, between the medical professionals and administration. So for the medical professionals, we need to share key information regarding patients and facility. It's important between nurses and doctors as both types work on one-to-one with patients. They diagnose them, monitor them, monitor their health and the prescription or administration of medications. It's important between the medical professionals and patients as doctors and nurses need to be clear when verbally communicating, particularly when discussing significant procedures and prescribed medications. Clear communication helps patients to communicate, helps patients to understand their problems, and for the different specialties, the referrals is very important. You do referrals for other specialties for taking opinions, so you have to make a clear and precise message or a letter, as you do in writing. Doctors must clearly express their patient needs and delineate expectations for continuing care. You need it as well between the doctor, the medical professions, and the administration. So verbal communication with administration is important for doctors, registered nurses, charge nurses, and nurse managers alike. To keep track of schedules, budgets, and other important information or problems that you face in the healthcare that you would require the administration to help in solving this problem. And that's part of the multidisciplinary management. The nonverbal communication, if you look at the right side of the screen, so words which represents the verbal part only represents 7% of the required communication. 55% of the required communication depends on the body movements and body language. 38% depends on the voice and tone, modulations and pauses in your way of delivering the information. Nonverbal communication primarily revolves around body language and facial expression, and as I said, that represents 55%. To communicate effectively, professionals in every field should be aware of the body language and how their appearances communicate in delivering the messages. It is particularly important in healthcare as patients can pick up as much information from how medical professionals express themselves through their behavior, mannerism, as they can form their words. And that's examples of the nonverbal communications. So your posture while talking to a patient, don't speak to a patient while you're standing and they're sitting. You have to be in the same level, either sitting together or standing up together. The body language is very important. Eye contact with the patient, as same as you do for an interview. Try not to do blinking too much when talking to the patient. Tone of the voice is very important. Facial expressions, the smell. Don't be a clock watcher and looking for your watch all the time. So this means that you're not paying attention to your patient family or to your patient. Your personal presentation, the gestures, and the vesture of voice. There's 5 ways that nonverbal communication complements verbal communication. So it is not only one type. You have to complement all the types in a balanced way. So you deliver a clear message to the patient. This happens through 5 ways as mentioned. So repetition of what you've said, like saying no and shaking your head, adds to or reinforces verbal communication, like saying I'm angry and frowning. Highlights verbal communication by emphasizing certain words or phrasing, like, are you sure that this is right? Contraindicates the verbal message, like saying I'm angry with you while you're smiling. Substitution of verbal behavior, like shrugging your shoulder to indicate you don't care. And then the written communication. Written communication can be defined as any interaction that takes place with written words, whether handwritten or typed. Effective writing skills can have a significant influence in professional practices, such as writing the following: emails between different colleagues or within the department, or in reply to all the authorities required or working with the patients. or to the GP, for example, department memos, newsletters, schedules, monthly or quarterly reports, research studies as part of written communication, and the medical notes when you do for the patients in the ICU. The best example for the written communication is the medication errors. And I think we all know that and we're aware of it. Then the remote communication. So co-locate team members working in the same place and mainly communicate through face-to-face interactions. But some other teams or team members that are not co-located predominantly use information technology to communicate, collaborate, share information, and share their efforts. Some of them are from the past, some of them are new, like what's happening between different team members. We use it between the different doctors in the department for work regulation. However, it shouldn't contain any transformation or mutual sending of patient notes. You have to just for regulation of the work. Nowadays, as the COVID-19 situation, the Microsoft Teams, WebEx, Zoom, GoToMeeting, all these are tools and applications used for delivering education. Like in the departments, we deliver education now by Zoom, and we're delivering Zoom education right now for different parts of the world. So those are remote communications, but in the hospitals, the communications usually are in written communication. There's barriers to communication, and it differs depending on the level. So barriers on the organizational level, the problems here are either system failure, where the necessary channels of communication do not exist, or not functioning, or are not regularly used. Or message failure, you have the system, but the message failed. The channels exist, but the necessary information is not transmitted. Reception failure, so the channels exist, the right message is sent, but it's either misinterpreted by the recipient or arrives too late. So each of these communication problems can lead to human error and affect the safety and performance. Hazards that reduce the quality of communication between team members, so that's at the team level. Failure during transmission process, sending unclear or ambiguous message, or language problems. As I said at the beginning, healthcare is formed of multicultural professionals. Difficulties due to transmission medium, like background noise or distortion. Failures during receiving of the information, such as execution of another message, or misinterpretation of the message, or disregarding the message. Failure due to interference between rotational and emotional levels of communication, like arguments, so this distracts people and gets you out of the topic. Physical problems in listening or speaking, like impaired hearing, wearing equipment such as oxygen masks or personal protective equipment, and that's our life nowadays. And another type of external and internal barriers to communication. So the internal barriers are the language differences, the cultural differences, the different motivations between people, different expectations, post experience, prejudice, status, emotions, moods, deafness, the voice level as well. Someone speaks low pitch voice, you don't hear all the words. Special slangs, special accents, didn't pick up what they mean, so never ever go to do something or take a message unless you clearly understand it and ask the patient can say it again or rephrase it or paraphrase it in other words. External noise, interference or disruption, separation in location or time, lack of visual cues like the body language, gestures, facial expressions, so all are complementary to the verbal or spoken language. So in conclusion, communication is key. Effective communication skill benefits medical professionals and patients and can have positive impact on health literacy. When patients have a strong foundation in health literacy, so healthcare providers can deliver care and improve the patient outcomes. Medical professionals should accept the different types of communication in their day-to-day lives, from effective verbal and non-verbal communication to accurate written communication. Thank you.
Thank you, Dr. Ahmed, for this presentation, which is very nice regarding the types, the barriers of communication, which we all need to know. I'd like to know if there is any questions. Okay. Okay, thanks again, Dr. Ahmed. And,
Thank you very much.
thank you.